and great to have this moment of hush. We're going to get started. So welcome everybody to this panel, Resilient Cities, Reimagining Health, which I think is actually really one of the most important sessions I've been involved in during the course of this week. My name is David Schuckman. For a very long time, I was BBC News science editor, and before that, environment and science correspondent, covering climate change and the whole host of issues. Back when I started, health and climate were treated as separate subjects. That's just how the BBC was organized. No one questioned it. I didn't question it. But gradually, in recent years, it became more and more obvious that the two are completely intertwined. And then a third strand, namely cities, well, no one owned that as a subject. I mean, it's not the business people, it wasn't us environment and science people, it wasn't the health people. So it kind of fell between the gaps, I'm ashamed to say. So I'm really, really pleased that these different strands have actually become united and intertwined, and more people going back just in the last few years, but really building momentum now to see that it's one subject and it's absolutely critical that we get it right. Just before we get into the main business of the session, I think, given the week we've had, it's worth just restating a couple of facts. Climate change is real. Cities are on the front line of climate change because they get hotter than the surrounding areas, and they've got impermeable surfaces, so flash flooding is worse. These are facts. The burden on the healthcare systems in all our cities is increasing, partly an aging population, but also the effects of increasing extremes of weather. So we need to be thinking imaginatively about actually how we're going to handle that. We can't just stay as we are. And it seems to me screamingly obvious, and we're going to hear the case for this, that you have to prevent people from becoming ill. So they don't need to go to hospital. They don't need a carbon-intensive journey back and forth to hospital. They don't need to add to the burden of our already overburdened health facilities. For so many reasons, it makes sense. Brits amongst you here will know the name Ella Kissy-Debrah, age 9, died of asthma in South London, first person in British legal history to have air pollution recorded as a contributory cause of her death. She made 30 visits to hospital, emergency admissions to hospital before she died. The 30th admission was the final one. And if you think about the impact purely mechanically and logistically, 30 trips, all the staff involved, all the equipment, the carbon cost, all kinds of other costs, it's obviously blindingly obvious that preventing people from sliding into a terrible situation like that is absolutely crucial. And that's what we're going to tackle in the next hour. So I'm going to invite, first of all, the two hosts of this event to come up to the stage. So Glyn Richards from Bupa, Sheila Redzepi from Reckitt. I think let's both come up at the same time. And grab a mic, there you go. You could use that or that.
Can I just use that? Yeah. All right, let's do it this way. Since the mic is available, I'm going to go for that.
Make it easy. Let me get my water out.
Wonderful. Well, thank you so much, David. It's really great to be here. If you're here on a Thursday afternoon of Anga Week, with all the heat and traffic and all the events underway, you're absolutely a fighter, and this is the place we need you to be. I think for most people in this room, it's some of the things we're discussing today are blindingly obvious, but at the same time, it's super important that we state the facts, and you've done that, David, already, and we look forward to the discussion that's about to start. I just wanted to extend, and I know Glyn is right here. I feel like we should stand together because we're a great double act, and we do this all the time. Really to extend a warm welcome to all of you on behalf of the Sustainable Markets Initiative Health Systems Task Force, all of our great friends at Yale School of Public Health, Mode Economics, our friends at Resilient Cities Network, Bupa, our partner in what's the word that we should use, our partners in this effort and our friends at Sanofi. Really a warm welcome to all of you. You're the experts. Our panelists bring a great wealth of knowledge and expertise and are really the ones that can shed a light on that important intersection of climate and health. Health systems are under pressure. Climate change is exacerbating those pressures. Cities are on the front line of those pressures. I think most of us know the data, but we're going to get into the information very shortly. What we really need at this point in time is very tangible and practical solutions in the hands of people who get this job done. So I'm really excited to see what the next steps in this journey are going to look like, and I'm really grateful to all the partners who have made a contribution to this. Glenn, you're one of those partners, so please jump in.
Thank you, Sheila.
This time,
Thank you.
Right, and I'll support
can I give you this,
you.
David?
Oh, yeah, sure.
Thank you. So, I mean, thank you very much. Just to add my thanks, it's incredibly gratifying to see this room full with people who are keen to hear the findings in the report, to hear from the specialist, the experts we're about to hear from as part of the panel, and also to hear a voice, a health voice from New York City in a second. But I mean, from our perspective, we're a global healthcare company. So for us, this is a very real problem, right? We see this in our front lines. We see this in our hospitals, in our clinics. We see this show up in our healthcare data as it comes through from a claims perspective. And what is very, very obvious, and I hope obvious to everybody in the room, this is slightly self-selecting, but what is obvious, I think, is the fact that you cannot have healthy people unless you tackle the determinants of health, right? So if you're not tackling the poor health determinants in urban environments where half the world's population already lives, and that will grow to something like 70% by 2050, if you're not tackling that challenge, which sits broadly outside the health and healthcare industry, then you're not really going to solve the crisis of delivering accessible, affordable, patient-centric healthcare to your customers or indeed the population at large. So for us as healthcare and consumer healthcare companies, it was very obvious that we needed to collaborate outside of the typical kind of forum, have the conversation with other industries, to work with the likes of Resilient Cities Network, to leverage the power of the Yale School of Public Health, to have supporters like Sanofi, to really kind of bring this together and to present something that, with the benefit of mode economics, that computed 11,000 cities worth of data, to present something that's very tangible. And I think that was critical for this. It's not just a report for the sake of putting it on the shelf. This is about something that can be taken off the page and made real. And that's what's super exciting.
Thank you very much.
Thank you.
That's brilliant. Thank you very much indeed. That's great. And yeah, so the report we're going to get into in a bit more detail shortly, but it's a great pleasure to invite to the stage next Dr. Ashwin Vasan, who until quite recently was New York Health Commissioner. Ashwin, do come to the stage. Take one of these if you're a roaming sort of person, or stand at the podium, whatever you'd like.
I'll use the lectern. Look at that imposing face. Sorry. Sorry about that photo. It's nice to be here with all of you, and yes, thanks for braving the Midtown traffic. Interestingly enough, Midtown East, where you are, is one of the neighborhoods in New York City with the worst air quality in the city, and yet it is not one of the neighborhoods with the worst air quality related health outcomes, like asthma. Childhood asthma is worse, for example, in the South Bronx. So it tells you that these effects, while they might be local, are spread out across populations. My name is Ashwin Vasan, and until recently I was the health commissioner of the city, and I'm very proud to have recently joined the faculty at Yale, and I'm very grateful to Jeanette and the Yale team and to all of the partners here for having me. And I'll be brief. There's a lot of reports being launched this week, a lot of reading that people may or may not do, most likely will not. Maybe you'll run it through a large language model to get the bullet points. Who can blame you? But I want to bring this point home that these findings and these recommendations and these best practices that emerge from the community of practice of, I believe, 29 cities, notably New York, not one of them. We need to get New York to be a part of this coalition. are real, tangible actions that can be taken at a local level to both adapt to a changing climate, mitigate its effects, and to prepare our populations through prevention to make them healthier and more resilient. When you lead the largest municipal health department in the country and one of the largest in the world, you come with a set of expertise. I'm a medical doctor by training, and climate is not really one of them that you learn in medical school. And yet very early on, as you're thrust into extreme weather events, as you're thrust into emergency heat days, as you read the statistics that over 300 New Yorkers alone die from extreme heat every single summer, you start to realize very quickly that this falls into your responsibility, and it becomes incumbent upon us to devise integrated strategies to attack the effects of climate and health. And so we did just that at our New York City Health Department and built a climate and health program, not because we have all the solutions, but because we wanted to demonstrate that this is not something against which you have no agency, that you are not powerless in the face of a changing climate, much of which you're not responsible for. And yet there are many things you can do to protect, particularly the most vulnerable members of your community. But meanwhile, and as any good public health doctor will tell you, we are addicted to healthcare. We are addicted to the idea that you can catch all of these problems after the fact and treat your way out of it, right? Healthcare has become a wastebasket for a whole host of social, political, cultural failures upstream. And we wanted, coming out of the worst of COVID, to say, how do we reorient a city-state of 8.5 million people towards a prevention agenda? And how do we make the case to the people that healthier, longer lives is actually a common goal, a common and measurable goal around which we can organize, invest, hold ourselves accountable, and even pass into law, which is exactly what we did with our Healthy NYC agenda. Why am I telling you these stories? Because you have these two disparate fields, climate and health, that, as David alluded to, are increasingly becoming more and more and more integrated, but they are tangible actions that one can take, especially when one has the privilege of leading a large government department like I did. I'll end on this note. It requires leadership. And why this report is so important is that it's highlighting the role of cities in taking that leadership. Throughout this entire week, we are watching a retrenchment of the nation state. We are watching a reversion of values right in front of us. Values that have held us together, of cooperation, of mutuality, of global concern. We're watching that slowly involute. And what I would say is that it's now more incumbent than ever that leadership comes from other levels. Not just government, but also non-government actors. Not just nation states, but especially cities, municipalities, localities, states, sub-states. And so I'm glad we have an audience of supporters that know this, that are engaged in this work every day. And this report is a great contribution to pushing the field forward. So I'm sorry I have to depart, but I'm glad you're having this conversation today. Thank you for having me.
Very quick thought before you leave.
Sure.
If you don't mind. Clearly, every city in every country has different political arrangements. Some powers, absence of powers. What was it like for you when you were in office trying to affect this health program without the city you worked for having all the power?
I think there's more power than you think in the positions that you hold. These are positions of great privilege and responsibility, and often we leave power on the table because we're afraid to ask. In New York City right now, we're seeing what a crisis in leadership can, even at the local level, can result in. And it's in all honesty, it's one of the main reasons I'm no longer in that position. And so I think there's actually much more we can do. We need local leaders who both have positions of political import and technical expertise to take that up. No longer can they hide behind the fact that they're just counselors, but they're actually leaders in their own right. And when they see something that is important, when they see something that's pressing, they need to push for it both internally, using the tools that they have, but vocally, setting the stage for action for elected leaders and others to
That's a great
make
message,
a choice.
thank you. So there's more cities can do than they realize, perhaps.
100%.
Yeah, okay. That set up the next element of the program brilliantly. Thank you very much indeed. And Ashwin has to run there. We're going to hear more city voices now. We have a little video. Let's roll the video, please.
Climate change is an existential threat. It affects everybody.
Our cities have identified that public health is a key issue for them.
Your health is driven by where you live. And if you've got huge numbers of people living in urban centres, then there's a need for us to think about how we redesign those urban centres.
Climate change is intensifying the risk of infectious disease, changing population movements, and impacting people's mental and physical health.
By partnering with cities to understand the value of preventative healthcare solutions, we not only help people live longer and live healthier, but we reduce the burden on the healthcare systems, and we reduce, therefore, the emissions of those systems as well.
Colaborar com outras metrópoles nos permitirá encontrar juntos soluções eficazes e implantar ações concretas para enfrentar este desafio global.
We know that good health and well-being begins not in hospitals and clinics, but in our homes, our habits. As pressures on our health and health systems grow, supporting people to protect their health and well-being is more important than ever.
We bring our member cities together with a willing consortium of private sector partners to work together to address some of the most pressing issues facing our cities today.
Great, lovely video. Fantastic. So we've heard about this report that actually lays out the facts, lays out the findings of the case for prevention. So let's move straight on to Jeanette Ikovitz. Please give her a warm welcome to the stage. Thank you.
Thank you, David. Can put on the first. Welcome. It's my pleasure to welcome you to the Yale Club on behalf of my brilliant colleagues at Resilient Cities Network, at Mode Economics, and of course our supporters from Reckitt and Bupa and also Sanofi. You can please start the slides. Oh, I start the slides. Okay, there we go. Perfect. So as we've already heard, cities are at the forefront of this crisis. And more than 50% of people live in cities right now. The United Nations estimates that 70% of people will live in cities by 2050. And the question really is, how do we promote resilience for all in the context of increasing climate threats? And we believe that a focus on cities is going to enable us to touch the most lives most efficiently and effectively, I should add. So before I turn to the solutions, let me acknowledge some of the challenges. We estimate that 2/3 of all health risks are actually in cities are influenced by climate. And what we see here from the report is that the average city inhabitant faces 7 times the WHO's safety limit for PM 2.5 air pollutants. And this gets directly to this really important story that David talked about you know, not just a statistic of 30 trips to the emergency room, but as you know, and as you shared with me, a real 9-year-old girl, somebody's beloved daughter, granddaughter, sister, friend. Secondly, we expect 45% of an increase in heat-related deaths in cities in the next decade as climate risks intensify. And this is all within the context that 76% of global deaths are now caused by non-communicable diseases, growing rapidly. And this slide shows that growth in terms of, and the health and healthcare straining under that growth. So in the top left, let's see if I can do that. There we go. The first bubble here is the year 2020. These data are real data in terms of increases from 2020 to 2025, in this case of global non-communicable diseases, prevalence by the billions. Non-communicable diseases are diseases like heart disease and diabetes and asthma. And the orange here is the expectation by 2030. So this one is non-communicable disease prevalence increase. We also see the aging population, not quite linear, but rather more exponential, and that will add strain to health and health systems. Here we see this bit of a rough and ready line, but there's no question it's going up. And this is the global healthcare spend as a percentage of GDP. And finally, if we do nothing about climate change, we will see the average global temperature projected by 2030 to be at 4.5 degrees. We know that the agreement for the Paris Accords is much below that. So based on our analysis of 11,000 cities, we find that a small set of evidence-based, low-cost interventions can save lives. As a professor of public health at Yale, I can say that these are some of our basic tools. They're evidence-based. They're things that we know work. If we begin with lowering deaths from simple environmental measures that target heat and air pollution, we will reduce these deaths by 15%. And these are things like cool roofs, urban greening, and active transport, all which will reduce the air pollutants, the PM 2.5, by 10%, and have then an exponential effect on health. Positive effect. We reduce these, the environmental stressors, and we improve health. Second, if we contain risks through infrastructure and community intervention, through safe and reliable water and sanitation and hygiene, these are the most fundamental principles of public health. David and I were just on a panel today with the water minister, ambassador of South Africa, who said, water is life. And indeed, that is true. And if we address the basic water needs of access and quality, we can reduce deaths by 17%. And I should add that, climate change, of course, is increasing the risks of flooding and more often and more extreme, and therefore impacting water quality. Third set of interventions, we need to improve community response capacity by emergency response planning, heat action plans, education and awareness campaigns. Basic, but not a small effect, a double-digit effect, a 13% in related deaths from enhanced community resilience. In work that Resilient Cities and I did, funded by the Rockefeller last year and released not on this stage, but in New York City Climate Week, we found that less than a quarter of cities, about a quarter of cities, had city resilience plans that addressed both climate and health together. So we can identify these gaps in order to see that there's a lot of room for growth. And finally, if we address underlying health vulnerabilities, we can reduce by 6% deaths from measures to promote active lifestyles. So if we do all these things, if we can mobilize action in these ways, through rigorous economic analysis led by Mode Economics, and with a lot more methodology in the report, so I do urge you to read the report. I can promise you these numbers have a strong backbone. But we found that we would save $70 billion in healthcare costs per year by 2030. 725,000 deaths a year could be avoided by 2030. This is 600,000 more than the number of people who live in New Haven, if you want to think about for the locals. And we could reduce 15.6 metric tons of carbon in healthcare emissions saved annually by 2030. So these simple, cost-effective, evidence-based solutions can result in this. As Ashwan mentioned, in addition to the scope of the economic analysis covering 11,000 cities, we're working deeply with 29 cities in 19 countries around the world through a community of practice led by Resilient Cities Network, and we will hear soon from our colleagues in Mexico City and in Rio, and they will come up and tell you more about this effort. Now, we talk about cities in this sort of uniform way, but I do want to acknowledge that we do recognize, I recognize standing here, but also in the report, that cities have varying needs. Of course, there are fast-growing cities like Dhaka, rapidly urbanizing. We've got transitioning cities. We put Rio in there, Jakarta, middle-income cities often experiencing a dual burden of persistent communicable disease together with rising non-communicable disease. And of course, again, with the very heavy load of climate change on that and the risk to vulnerable cities. And then what we call established aging cities, like giving an example of Stockholm and Toronto, higher income, slower growing, different challenges. But there are many challenges that are similar and many solutions that we can invoke while we recognize that climate change is global and the solutions are inherently local. We think cities are important, not just because they're cities, and I think in many of the stories that Ashwan shared, but also because they can coordinate actors, and maybe this is some in his answer to your question, David, of leaders having more power than they may know. The power to convene, the power to coordinate is really important. And part of what we are doing collectively is bringing various stakeholders to achieve health resilience with synergistic goals on climate and the economy. So you can see here, I won't go through it, but of course we've got the formal healthcare sector, the business community, community groups and NGOs, governments and multilaterals, investors and banks. I do want to say that on the banking side that this is really critically important. We do need the resources, and cities and everybody else needs to recognize that every dollar spent on prevention easily returns $3 in quality of life, and for the wonky people in the room, and some of my former students, disability-adjusted life years. So every dollar spent saves 3 in return, at least 3 in return. And then, of course, research organizations like mine. And this is the last slide before we open up to the panel, but I do want to say that the report is the first step, not the last step at all. So we are really thrilled to be making the case for prevention and preventable healthcare approaches here today through the report and here on this panel. Our next steps are to co-create with our city partners highly practical tools and resources that respond to their needs. And perhaps the thing I'm most excited about as an implementation scientist, among others, is that we are looking ahead to implement the interventions that respond to city needs across a wide range of contexts to promote climate and health resilience. And I'm just going to close with a brief remark to say that this work is more important than ever. And we're reminded by that this week. And I just want to reflect back just a few months ago when on his first day of office, Trump issued an executive order to withdraw from the Paris Agreement. And yesterday, the United States just failed to show up. They just didn't go to the climate summit. Thank you. They just didn't show up. The hostilities toward climate science, climate scientists, and renewable energy have continued to escalate. And I think it's really important to call these out because I've been here all week, I've been to numerous panels, and I think people are tiptoeing around. And if we don't say it on the last half day, then maybe it's not said. Now, while the US failed to show up, skipping the UN climate session altogether, the EU, China, and almost every other nation set forth ambitious targets. And I want to say that if we are to meet those national targets, we must promote health and equity for all by implementing the kind of solutions that we outlined in our report. And if we are to meet these national targets, then we need to continue to cultivate the kind of public, private, and philanthropic partnerships that are going to make that possible. And finally, if we are to assure that these national targets are met, then cities will be at the heart of climate and health action for all to promote resilience. And with that,
thank you very much.
Thank you.
Great, Jeanette, that's fantastic. Very, very clear and brilliant to see the results and everything. Right, grab a seat and let's invite the other panelists up to the stage. Marina Romanello, where's Marina? There's Marina from the Lancet Countdown. Ghislani Mateus from Rio de Janeiro. Very welcome. Please find your way up to the, so grab a seat wherever you want. Well, I'll go at one end and I can keep an eye on you all. Would that be better? And last but not least, Ana Mendeville from Mexico City. Ana, thank you. Please. And Amelia Carrera, I didn't know you were here. Forgive me. There was such mayhem early on. Okay. Good to see you. Very good to see you. Very good to see you. Great. Please grab us. Has everyone got a mic? Everyone got a mic. Let's begin with cities. And when you see the results of the study with these very practical interventions and very factual outcomes, how does it connect to you? Does it resonate? Does it make sense?
Hello, everyone. I'm so glad and honored to be here. My English is not very well, like you see, but okay. This first report is a strong call to action for cities. It's very makes sense. So cities are on front lines. We've heard this many times in this afternoon here. And the climate crisis is the health crisis too. So this report shows us cities have the best chance for do more things. They have the best chance to save lives from climate risks. So this reality has pushed cities to innovate with low costs and high impact actions. So it's more than a report. It's a roadmap for cities, I think. So Rio de Janeiro is very honored to be here because Rio is improving our resilience too. Rio had already sustainability plans, developed plans, contingency plans for floods and everything, but not for heat. So Rio turned a tragedy in November 2023 because a severe extreme heat wave, and building your resilience with an early warning system for extreme heat with health and climate together. So showing us this is very important. Cities can be part of the hope. So it's, I think that city can do many things.
That sounds really fascinating and it's great to hear. And by the sounds of it, your city leaders buy this argument. They understand it. They understand the value of doing this to get a result.
Yeah, and data can show us the value. So we can not only count deaths, but we can tell about deaths avoided in cities when cities have improving resilience and health systems and climate teams and plans, developed plans. So it's very impressive. And so
That's great. That's great. And from the perspective of Mexico City, Anna, tell us your reaction to seeing these results, how it helps you in your work, whether the extent to which it's useful as you try to persuade the city to take these steps.
Yes, thank you. Thank you for the invitation. For Mexico City, rethinking health and climate is to think about social justice. So for us, it's really important. These kind of reports help us to move, like from these national policies, like written in desks, to move to territorial interventions in our cities that are focused on people's rights and people's well-being, and they are also like built in local evidence with policies tailored to the city's conditions. So I think these kind of reports are the ones that help us in that way. They are kind of like a roadmap for us to identify like these kind of opportunities. Specifically for us, it is important that resilience and adaptation policies try to address these underlying conditions of vulnerability of the people, because like we say in Mexico City, like that the disasters are not really natural; they are socially constructed. So for us, it's important to address all of the social conditions that generates a disaster in terms of health and climate change. So this kind of information is really important for us, specifically in like it gives us like the route in 4 types of goals. The first of them is like to redesign public policies, not only climate and environmental policies, but multi-sectoral policies like mainstream health and a healthy environment as human rights, because they are human rights. That mainstream these issues, for example, in sustainable mobility, in green in the city, in food systems, so we can address these issues in multi-sectoral policies. The other one is to address the transformation of the health services. For example, first, in terms of prevention, because most cities only act on reaction, and we think health as hospital admissions, but we don't work with communication with the communities in terms of preventive health, but also in terms of mental health, because the climate crisis will increase issues related with mental health. The third goal that we have, like related with this study, is to create to mainstream like a preventive culture in people. So people actually protect themselves, that people think about their health, and also that many of these issues are addressed in terms of community management and community, for example, community early warning systems, community brigades, community act solutions. And the last one, and I think it's important to say for me, like as a woman and as a feminist, it's also important that these kind of results also help us to redesign the way that we think about care. Because if we don't address these issues in terms of equity, one of the main results that we could cause even more inequalities if we don't address the issue that climate change is increasing the care burden, specifically for women that are considered like socially responsible for care. So it's important to address women, to address informal settlements, to address low-income people that are like the ones that will like live these reports like.
Great, thank you very much, and that's a really comprehensive approach and lots of different angles. Marina, when you look at the report, you hear the sort of needs and thinking of the cities, what do you think works best? Are there some measures that are going to be easier than others, or more effective, but perhaps politically harder? What are your thoughts about as you try to make this as practical as possible for cities?
No, That's a great question, and thank you so much for sharing your thoughts from the city's perspectives, and thank you for what is an enormous amount of work and a really impressive report. I was looking at the data that you presented, and it's so compelling. It's just so strong, and the message is crystal clear. I think there's no doubt that there is a huge burden coming on cities, and that cities ultimately are not only the best position to drive a response because the vast majority of the population lives in cities, but also because you have such good integration in government. It's much easier to integrate and work across departments in cities than it is at a national level. And I just wanted to note how impressive that Mexico has a director of climate change. It's really unique. So and to see that it's a woman, no less. So cities in general are really forward in this, and it's the demand from the population to cities very direct. The bottom-up action is also very direct, and whatever cities get right will impact populations very directly, and they're just at their doorstep. What they get wrong will also affect populations very, very directly. So we speak a lot with policymakers from the Lancet Countdown. For those of you that don't know what the Lancet Countdown on Health and Climate Change is, it's a big research collaboration, and we produce annual indicator reports with a stock take of the state of climate change and health globally. And we interact a lot with governments. We generally do so at the national level, but the interesting thing is that much of what our data shows, much like we have just seen in this report, reflects on actions that could and should be delivered at the city level. You were asking me about what is the action, what is kind of the... One thing that we found, and is there anyone from the Lancet here? Okay, don't tell them that I'm sharing this, because it shouldn't be shared until the 29th of October, but embargoed information now. So in our latest analysis, we found that there's about 2.5 million deaths from air pollution happening globally. Over half of that, 1.5 million deaths, come from the burning of fossil fuels from the transport sector. It will be no surprise that the vast majority of those 1.5 million deaths happen in urban centers, where we keep on burning toxic fuel at the doorsteps of our schools, our homes, our walkways, our workplaces. So I think in the transport sector, it's one of the areas where there's the biggest opportunity to drive action. And it's important to be very mindful of how we do this. We've seen it backfiring in London, where we did lots of progress.
Yeah, I mean, the mayor of London had death threats.
Yes, absolutely.
For extending the pollution zone.
Absolutely. But the reason was that it was affecting people's daily lives. We are very short-term individuals. We care about how difficult this morning is, and we care how difficult my day tomorrow will be, and how I will get to work. And all of these things are very hard to implement if you don't have support from people. We are hearing a lot about electric vehicles, which are fantastic. There's such a revolution of increasingly affordable electric vehicles. If you don't have a charging point or an opportunity to charge the vehicle in your house, no matter how cheap it is, you just cannot have it. And they still are pretty unaffordable to most. So I think we need to keep in mind that climate action, to be effective, needs to be desirable, needs to be sexy, needs to be feasible and easy. And there's nothing better than a city with a good public transport system and a good active travel system. And that is where I think many cities get it wrong. I come from Buenos Aires. Our public transport system gets you everywhere, but it's dangerous, it's inefficient, it's messy, and people will choose a car whenever they can. I live in London. It's a very different type of transport system, where if you can, you will avoid having a car to move from place to place in London, mainly because we will be stuck in traffic, but also because it's very efficient to move by public transport. So we have to make sure that as we put forward the data and as we make these recommendations, on the other side, there's people's daily lives that are affected, and it's people's power that can drive this action bottom up as well.
That's so interesting, and you mentioned, the potential for backlash, and that can get whipped up politically and become a thing. Amelia, what's your take on this? I mean, there's obviously much of the report, if not all of it, is really landing well with the cities who've taken part in this, and it's obviously, I'm seeing these nodding heads, it's obviously very useful. What do you identify as the most useful levers, the most effective ways of delivering the kind of change?
I think, and I think the colleagues here from the cities are the best ones to speak to this, but I do think that cities are these places where they can innovate, they can be creative, they can test things out, measure it, adjust and adapt if needed, and then scale it. And what we are seeing is that cities are not only scaling it across the city, but I'll take the example of Rio, and Ghislani can maybe expand on this. By creating the heat action protocol in Rio, I think it triggered something at the national level. This is the first city in Brazil creating a heat action protocol, and it triggered something at the national level that got the national level talking about heat and health and climate and health. And these are the secondary effects that sometimes are really hard to capture and are really hard to measure. But I think that's some of the things that the magic of what cities can do.
Do you think that translation from city level at Rio to national was to do with events? I mean, terrible heat waves, the death of a young woman at a Taylor Swift concert in Rio because it was 60 degrees in the stadium, or more because of the action the city was trying to take with the heat plan? Or maybe both?
It may have been both.
Yeah.
Can't really tell or pinpoint. I think there are multiple variables here. But I think that the fact that the city took action, it had the leadership being very vocal and open and supportive of something like this, and then putting into action. A year later, there was another extreme heat in Rio, and they put this heat action protocol into practice, and they're capturing what the impacts of that plan was.
That's really interesting. And Jeanette, when you sort of hear how, I mean, as you said, you don't want the report, just to kind of be there and sit on some shelf and look pretty or whatever. Or someone said that, but actually it's got to be a blueprint for action. From what you're hearing about the reception and how it's going down, are you enthused? Do you see potential for this to be taken forward, to catch on?
Absolutely, we're thrilled. And I love that, I think Ghislani was when I said that, I love that it's a blueprint for action, because, my catchphrase, this morning, you said 3 words, and I said?
This was a challenge I gave all the speakers.
And then he cut us off in between. But I said, okay, David.
You did really well.
3 words, evidence to action.
Right.
I think relying on the data, this analytic report, this economic valuation, and bringing that as a blueprint to action is exactly what we hope. And that is bolstered also by the deep work with cities, with Ghislani, with Anna, with the other 27, and according to Ashwin, maybe New York City will be number 30, and many more. And I think this opportunity then to scale up, first through the Resilient Cities Network, we start with this 29 cities, but there's an opportunity to scale to 100 or more. And I think also, just to hone in on, Amelia, on something that you said, one thing about cities too is the agility. And we do need to be agile, particularly in this day and age. So we need, in order to be effective, we need to move forward with what works, and we need to quickly move away from what doesn't, and be willing to use those data to drive more change.
We've sort of, in different ways, all touched on the subject of how, certainly at national government, and as I described in the BBC, you have these compartments. So at national government, there's transport, and there's health, and there's other stuff, and that was certainly what happened where I worked in the newsroom. At the city level, Anna, I'm wondering whether in Mexico City, do you think it's understood more easily at a city level that everybody's effort is relevant to everybody else's? So the transport people can't just do what they want to do, but it actually affects health. The education people are part of that. I mean, is that being understood? Is it more easy to convey, do you think, at a city level?
I believe it is, at least in Mexican cities, most of us, well, Mexico City has like a special like regimen because we are a city and we are also a state. So we have much more money than other cities in Mexico.
And more power, I guess.
And more power, yeah.
Right.
So, but at least in Mexico City, we have, we for example, direct a climate group of action of other cities in the country. So we have seen that many of them has followed like an example set by Mexico City, that we create a climate change commission, and we also have a resilience commission that actually works together. And the issue is that we have like regular meetings to mainstream climate change in all of the agendas. And also our laws establishes that all of these institutions have to report what they're doing in terms of climate change, what they're doing in terms of resilience.
So there's an obligation.
Yeah, so that's why many of them, like, they act in terms of climate change and they act in terms of resilience, but they like don't call it climate change or don't call it resilience. So that's the way, like, we from the Minister of Environment, we draw the pathway and determine the goals, and we try to orientate them to work on these issues. But just like creating these kind of mechanisms and maintaining communication and climate transparency helps these institutions to work towards that goal.
And Ghislaine, do you see the same in Rio, that people working in different departments of the city administration understand the connections and how they all need to work together? Because I can think of lots of examples where that doesn't happen. But in Rio, does the sort of logic of this make sense?
Yeah, it makes sense. Rio is a peculiar city. It's the second largest city in Brazil, and climate action is not. It is a subject that city is working in the last 2 years ago. It's not recently, but I would like say about the climate mitigation plans is very important, but the impacts of climate change are now in the cities. So cities have action quickly when have the risk. So the heat protocol in Rio, it's not only data. He was built in evidence, in data, and health records and climate data, but he is an action plan, action protocol, not just only health or climate, but communication team, transport, education, so the routine in schools are changed. So events, opening cooling centers, so it's about time for action too. So in real time monitor, but have predictive models too for the next days, next week, because in health services, time is essential. So for cities, unlock financing is very important. Can I take about finance? Okay, because in Rio, there are different sectors in the city, but we are working together with goals, with plans, urban plans for strange climate risks and climate change. So cities need financial support to move faster and move forward. So we are now working sectors, across sectors, but with other partnerships too. So like Rockefeller Foundation, C40, for move faster in this challenge now.
Great, thank you. In a sec, I want to open this up to questions. We're really keen to hear whatever observations or questions you have. But just before we do that, should we just cast ahead? Jeanette, you laid out that sort of flow chart for next steps. Do you want to just talk us through specifically what the goal would be in your dream world? What would the ideal outcome? And it'd be nice just to go along to see where you'd want to be with this agenda in, I don't know, 3-5 years' time, let's say.
How aspirational should we be?
That's a bold question. Just to give us a sense of sort of what milestones maybe ahead would be significant to you.
I mean, we are prepared to move rapidly with the support through the Sustainable Markets Initiative and this really, really dedicated team, you know, multi-sectoral team. So first, and it's already underway, is the co-creation of these tools and resources. And Anna and Gislani and their counterparts around the world are really helping us to leapfrog those efforts so that, you know, that's not a 3 or 5 year plan. I mean, that's a 3 or 5 month plan so that we can move ahead toward implementation. So in my ideal world, we take those 4 suites of interventions that we know work and we begin to implement them. Now, we can't do it all things everywhere all at once, but we can strategize, and the cities can identify in my city, in our cities, maybe regionally as well, this is the priority, this is where we'll start, and we will move to scale up in that way.
I've just realized that I'm so used to the incredibly slow global progress on climate. The idea of something in months just blows my mind, but that's great to hear.
I did kick off saying, well, my aspiration.
No, but we need aspirations this week of all weeks. We do. Marina, where would you, just give us a sense of next steps, progress, where would you like this agenda to be, any time frame? Let's go with months, if you like. I'm happy with a few years, but anyway.
I'm going to be incredibly boring. So cities are increasingly doing the risk assessments and their plans for adaptation and decarbonization, and we're seeing so much momentum, and cities really committed with their plans. I'd love to see those plans being implemented and evaluated. We've been trying to get evidence on what works on climate change and health, and everyone is trying to look for which is the solution that works. And we're like, well, mate, I don't know, implement one, evaluate it, and we'll tell you if it did.
Yeah.
No one is evaluating interventions. So I would love to see cities implementing the plans, evaluating them, and implementing systems of learning, evaluation, and course correction.
And sharing.
Exactly. It's not a one-off thing. It is iterative and happens in loops, and it just never stops. I'm sorry to tell you guys.
Amelia, where would you like to take us in the next, I don't know, little time frame?
I think this report, and more as we think about climate and health, it reminds us of a couple of realities. One is bringing us back to the basics of public health. And when we go back to the basics of public health, we need to be thinking intersectorally. There are multiple sectors that will be responsible and are responsible for health outcomes. So how do we engage them? And I think when we think about climate adaptation and we think about concrete examples, that may be a forcing function to help us build these connections between sectors. Going back to the example of heat. When we think about heat, it affects, yes, human health, mortality, morbidity, but it also affects agriculture. It affects education. So how are we going to work together? And to the point, I think that has been mentioned is, are there those governance structures for that intersectoral collaboration? I don't know. I think in some cities there are, because there's a political will, there's a mandate, there's an intersectoral table that's set up, but I don't think that's universal, and I don't think it's everywhere. So something that we are trying to do is, one, understanding what exists now that enables that intersectoral collaboration. It may work in one place, it may not work in the other. We cannot be prescriptive. And then the other piece that I think we need to be thinking more and more of is, we live in a new reality. I think a lot of our healthcare systems were built to be reactive and in response to a stable climate, and that's not the reality that we're living today. And so as opposed to having a conversation about, is it climate or is it health, what if we think about health in a changing climate? And we continue to evaluate, we continue to learn, what are these impacts and what can we do in this new reality?
Thank you. Yeah, health, climate change being a non-linear process. Whenever I hear that, it's quite sort of scary. Gislani, what what would you like to see happen in Rio in the next months, couple of years? I mean, you've got COP30 coming up in Brazil, I know way in the north, a long way from Rio, in Belém, but climate's very much on the national agenda. What would you like to see at the city level, how this agenda gets taken forward?
It's a good question, I'm thinking, because I would like to see many things. This is a really challenge for political, local governments and national governments. Emilia said many things about this. The real reality is not the reality of the other cities in our country. So, and in Rio, we are improving resilience after tragedies. So, yeah, we are now improving air quality protocol in the city. We have a large road to go away for improved resilience in the city. So we travel about the priorities in the city. So floods, heat, sustainability, improve green areas, change transport in city, but the risks are improving too, and faster than the city politics. So I would like to see in Rio more resilience before the risks. So, but I think Rio is advancing in compare other cities in Brazil. So Rio can teach and learning with other cities too. So,
thank you very much. Anna, where do you see things going in the next year or so? What would you like? Let's be aspirational. Let's dream.
First, I will say not what I would like, but what will happen. In Mexico City, we are currently updating our climate action program, and it is my goal and the government's goal that it would be the first climate change program that addresses climate change and health together. So for us, that's important in terms, not only in terms of resilience, but in terms of decarbonization of the health system, because the other programs only addressed, for example, like heat water systems in hospitals or something like that, but they don't address health and climate change together. So that would be the first one.
And when will you publish that? What's the timescale on that work?
The program will be like first, like it will have like a first presentation, like a brief presentation in 2 weeks, and then we will give like the legal presentation.
But we all want to see it.
Yeah,
I'm sure everybody in this room wants to see it.
During the Climate Action Week in Mexico City, that will happen in 2 weeks. So that's the thing that will happen like in the short term, and one of the things that we expect this report to reflect in Mexico City would be, for example, first to start creating like local evidence and knowledge applied to Mexico City, because we don't have that, we don't have data, we don't have statistics. That you understand?
Actually, I just said stats.
But we are working like on a preventive principle and precautionary principle. So the other one is to strengthen our monitoring system, because for example, we have in Mexico City a monitoring system for air quality that gives us that talks to population about health, but we don't have that related specifically to climate, only to air quality. So we are trying to expand that. And the other one is like to continue these kind of exercises, to work with other cities, to work with the private sector that will have, for example, new responsibilities in terms of a climate action program. The other programs that we have only had responsibilities for the government of Mexico City, and this will be the first program that will have responsibilities for other actors in the city. So that's one of the things. That
really interesting. And I think there's a room full of people who want to see how your work unfolds. Let's have some questions. Let's stick a hand in the air. There we go. There's one there. One further back. We've got roving mics. One there. Keep the questions if you would. We might group them. Let's just take, let's say, 3 questions. Brief as you can.
Okay. So forced displacement and climate migration are going to be major drivers of urbanization in the coming years. We're talking about up to 1 billion people displaced from rural areas largely to urban areas within their national boundaries. These are folks who are more likely to reside in informal settlements or in under-resourced areas. So what is the role of cities and how can they prepare for an influx of people from within their boundaries but who are going in without many resources to their name and who are settling in these places with poor
Really good question. So this is migration from rural to urban areas. What do cities do? Let's go, where do we have? Yeah, there we go. Thank you.
Yes, this panel is called Making the Case for Prevention. And I'm wondering what you're doing in terms of this money that you're saving. I mean, we're paying for insurance premiums. Cities have seen themselves lose insurance coverage. People, homeowners have lost coverage. Cities themselves. If you save $70 billion, where does that go on an accounting sheet? And this is the avoided cost question. And I would really like to know whether somebody is thinking.
We've got the internal migration question. I'm going to ask one of you to pick up that one, and then we've got, well, what happens to the 70 billion, which I think citizens would ask, and then there was another question there. Perhaps we can pick up the 3.
Yes, hi, thank you. So I'm interested both from the perspective of the report and then what the practitioners are doing. How are you looking at segmenting populations, and by that I mean specifically looking at different age groups? And I'm particularly interested in the senior population, which is growing tremendously. I've heard the phrase senior tsunami before, and there are many other issues beyond health, but would love to hear your thoughts on that. Thank you.
Aging population. Okay, let's do these in order. Who wants to pick up the migration? What are informal settlements, people streaming in from country areas? I'm looking at someone to nod and say, I'll take it. Okay, Marina, great, yeah.
I don't know if I have a great answer for you other than, yeah, it will be a huge problem and it's an increasingly vulnerable population and we will need to address it. We know that climate change is driving part of that movement. Both internal displacement and international displacement is occurring already because of extreme climate events and because of other pressures. And migration sometimes is the negative consequence of extreme events. Sometimes it's the only adaptation solution that we have when conditions in the place where people live have become uninhabitable or too risky. So I think the question is more about how can we support migrant communities to ensure that as they move from their places of origin to the place of destination, both en route and as they reach that place of destination, they have access to really good quality healthcare and they don't become the most vulnerable population to climate extremes both en route and at destination, and that health systems are also equipped to be able to cope with a huge influx and cities able to cope with a huge influx of these populations. It will happen more and more. The extreme right movements that we're seeing are not accidental, and that will also escalate. So I think it's something for cities to take very seriously and to have very proactive plans to ensure that those populations on the move are actually taking care of.
Thank you. We're really running out of time. I want to volunteer for the aging question, and then I think Jeanette has volunteered for the who gets the 70 billion.
I would like to say.
But very, very brief, please, just a minute. Is there an aging population in Rio? I guess there is.
Yeah. Rio is, Rio has more than 1,002,000 elderly people. So Brazil has a SUS, a universal health system. It's important to do because the primary care health unit in the city, in the neighborhood, is a resilience, improve the resilience that neighborhood for elderly people, for children, for pregnant women. So in this primary care health, we have health workers that live in the community, and they help the system for preventable measures and help what to do in this neighbor during risks, climate risks. So it's important for...
I'm going to stop you there because we're just running out of time, but maybe we could continue some of these questions afterwards in private conversation. Jeanette, I volunteered you for the who gets the 70 billion, which I think is a really good one. Just in 30 seconds, as we're going to wrap.
Critical question. I think I want to just say that between the migrants and the older adults, and of course pregnant women and children, these are vulnerable populations, and I think that taking those all together, you know, does ground the seriousness of this work and recognizing that that we need to especially address those who are vulnerable. That 70 billion is not yet realized. That's if we take the prevention efforts to make these changes, to enact to use this as a roadmap and then to enact the plan, then we could begin and hopefully will begin to realize that savings. It would be my hope that those savings get reinvested directly into cities, not only to improve resilience and well-being, but actually to promote thriving, to really push it out to all sectors, to improve transportation and education and the environment, and that we reinvest in order to, I guess I'll just say that again, to go from resilience to thriving. That's the aspiration.
That's a fantastic upbeat note to end on. Jeanette, thank you. Would you all join me in thanking a terrific panel? Thank you. Thank you.